The out-of-home care health pathway program is absolutely crucial for health outcomes of children in out-of-home care. My position is based here at the Orange Aboriginal Medical Centre, and I'm the out-of-home care health case manager for Western New South Wales Local Health District. I work with a really dedicated and passionate team who are committed to the health outcomes of children.
The advantage that we have here at Orange AMS is that we're working really closely with New South Wales Health out-of-home care team, and we can try and get together all the information on the child before they're seen. Sometimes we've looked after the patients before they went into care, so we already have a bit of family history or background history, and our local health workers are a really vital link for getting some of that information. Communication is really the big thing that we've got going for our team at the moment. We're all working in the same building, the child health nurse, the Aboriginal health worker, myself as the GP, the New South Wales Health out-of-home care staff member, Kate, and we have a lot of visiting services that come to our building as well, so we can actually talk face to face with some of those services that are providing other assessments and reports, particularly when it comes to developmental reports and things like that.
It just means that instead of having a child turn up to have a health assessment done who you don't know a lot about, and then you send them off with paperwork, that you actually get the background information. We often talk with the caseworker before we see the child and get more of a picture of where the child's at. At our intake meeting, Kate will fill us in a bit more, so we kind of talk as a team before we even meet the child.
As an Aboriginal health worker, I'm able to connect with the families initially at their first point of call when I make contact over the phone, just to have a quick chat with them to remind them about their appointments and if they have any concerns about coming into the service. I feel it's very important in making connection when we first initially meet with the families, as it is a very traumatic experience for our families to go through. As in the past, as we all know, there are so many of our children that have been removed. I'm very passionate about connecting with those families. In my initial contact, I will identify which country they come from, and that's how we make our connection and make our families feel comfortable. When our families come to our service, I'm able to greet them in the reception area, just so they feel comfortable. It's not a scary environment. I'll joke with the families. We'll make contact, yarning to see, that makes the families feel valued and also respected and feel comfortable.
So when we meet with the child and the carer, it just brings a whole picture together for us. So it's very helpful for the process to see that relationship in action, whether or not they seem to be getting on well and the child's comfortable. It just helps us to get a more complete picture of the situation. When the kids initially come into OAMS, we do a primary healthcare assessment, which lets us gather together all the information we need about the child and their health, which helps us to determine which referral pathways they'll require to complete their health pathway. Health literacy is a really important topic that we've been conscious of with the kids in care. We noticed with a lot of the older kids in care that they didn't have a lot of ownership about their own health. You'd ask them things and they'd say, I don't know, I don't remember. And we thought it's really important from a young age to start including the kids in their health pathways. So showing them the physical health plan blank and explaining to them that we're going to write down what we've done for you, your height and weight, and look in your eyes and ears on a simple level, and then talking about all the things that we think are important to keep them healthy and well. So going to the dentist and checking their teeth and all those kinds of things, and then asking them if there's other things that they want to include in their health plan or that they worry about in their health. It's also an opportunity to help them to understand health more broadly. So sometimes we ask what sort of things they love doing to relax or what sports they like, and explaining that that's part of your health. That's keeping your mind healthy and your body healthy, and giving them a chance to tell us the things that they'd like included in their life from a health point of view. We often like to talk to the carer without the child around, because it's really important not to be discussing children's past or their traumas or things that have happened when they're in the room. These children have been through enough already, and we want to make sure that their experience here is a happy one and a positive one, that they feel really comfortable here at OAMS as kind of their health home, where they're going to come for their health and learn to take ownership for their own health for the future.
So as you know, Aboriginal children are overrepresented in the out-of-home care population. Often the families have been transient, they've moved around a lot, had a lot of different GPs, and it can be really difficult to work out what they've had done and where they've had it done, and any underlying health problems they might have. Now, GPs are busy and paediatricians are busy. It's not always easy to track that information down at short notice. We're also reducing the load on the paediatricians in town. So if we can assess the child first up together, then we can work out who really needs to see the paediatrician and who doesn't. And then when they go to the paediatrician, we can make sure all the information goes with them. That means that the appointment with the paediatrician is more productive, and we can avoid having to bring the child back multiple times as we try and get all the necessary information.
Another benefit of the services we have here is that under the same roof we have dental services, so the kids who come here can actually come to the same building and see the same faces when they come to have their dental work done. We're able to do some audiometry screening on the kids here as well. If we refer the children for certain types of OT and physio and speech, then we have services that come here and offer that as well. And we also have a dietitian from the hospital who will come here to meet with the children and the carers if they have dietetic needs. So it's great that it's so rounded that they can come to the one place instead of having to go to numerous different venues. Home visiting is one of the unique sides to out-of-home care at OAMS. We're very fortunate to have a fleet of cars and the freedom to be able to go home visiting that work allows us to do, and we find it's been really helpful. Sometimes we are working with a family that might have multiple kids in their care, and it's hard for them to come in with all the kids or not have transport, or the child's not comfortable to come to a facility, and then we have the freedom to go to the home and meet the family and do the health check and assess the child at home, and the GP will come out as well. We always make sure that we have an Aboriginal health worker involved, and that's Vicky on our team, and it just puts the family at ease to have that cultural security and safety of knowing that there's an Aboriginal person there, that they feel comfortable that they can ask them questions or talk about the situation and clarify what's going on, and we've found that that's been really invaluable for our clients. So outreach is another part of what we do with out-of-home care here. So we do the out-of-home care health pathways for kids based in Orange, but we're also covering kids in a much bigger region. So Bathurst is 50 kilometres roughly each way from Orange, and we've started going across to Bathurst and doing a day every now and again where we'll have a group of kids who are all due for health pathways. So New South Wales Health, Cape Potts for out-of-home care will go, myself, Dr. Sky and our health worker Vicky, and we'll go across for the day. We've had kids coming across here from Cowra, Forbes, Parks, so more and more outreach. So Parks and Forbes are both a good 120 kilometres from here, but we've actually had caseworkers bringing children across for their plan because of how smooth and how well it runs here. So instead of for them waiting for a report from a doctor in one location and a dentist somewhere else, they know at OAMS it's all on the one site. So it's actually easier for them as well for their end with their paperwork and their obligations for the children's health in care.
I see one of the most important parts of my role as the out-of-home care health case manager is advocating for the children and their health needs. Part of this is actually having case conferences with the FACS caseworker or the NGO caseworker and actually figuring out what they see are the needs, and also once the assessment's occurred, advocating for what needs to follow up for the children. The way that we've found has actually worked has been to have teleconferences with case managers. Often we need to have teleconferences because the case manager may be in another area, may not be located in Orange. So even if they're still in Tamworth or Sydney, we can actually still keep that communication going so that they're always aware of what the needs are for the children and that everything can be entered in the plan for the children.
Once the health plan's fully finalised and signed off with FACS and they've given a copy of it to the family, we like to go out and visit the family. So usually Vicky, our health worker, goes out, and sometimes myself will go with her, and we just make sure that they're happy with the plan and that they feel like they understand everything that's in the plan.
As Aboriginal health worker, I'm able to visit the families in their home, sit down with them one-on-one and actually talk through their health management plan. If there's anything they don't understand, I'm able to either interpret and explain it in language that they know, or if there's anything that I'm not unsure of, I'll follow that up with our team and just be with them in the whole initial journey. I see it as a journey, as we're empowering our families to take ownership of their health and also identify the support systems that the community have within our local community.
Why it's so important for us to be a part of the out-of-home care is, one, the overrepresentation of our children in care. Two, that we are keen to get more of our Aboriginal people in our communities involved as carers. And three, that we have an opportunity here to change the lives of our young people. As the primary healthcare provider in this tripartite agreement with FACS and the local health district, we are the specialists in healthcare. We provide healthcare that is coordinated, integrated and culturally safe. Our team is committed to providing care for our children. It is incumbent on us as an Aboriginal Medical Service to be the driver of change for our kids that are coming into care. The overrepresentation and the projected increase of those numbers enforces us to take a stand. As an Aboriginal Medical Service, we want to be at the forefront of change for our people. Our focus in this tripartite agreement is around restoration. A lot of these kids are known to us through our community here in Orange, and a lot of the kids that are coming into care are from other communities. Our focus is about family health care, about restoration for our families, restoration for our kids. We can change their lives by being a part of the process. Supporting our children, supporting our families, supporting the NGOs, supporting FACS and the local health district to ensure that out-of-home care is an effective process for our children. We can change their lives, and from what we've already witnessed here, we're doing that. I would encourage that every Aboriginal Medical Service in New South Wales and even the country consider becoming a partner in out-of-home care. You will reap the benefits. We are here to change the lives of our people.